Hi, my name is Dr. Raja Adnan Ahmed, and I'm a psychiatrist. I work in UK. This video is part of my NHS job interview series, which I'm making for the international medical graduates, the doctors who are coming from abroad or who may be going for the first job interview in the NHS. And I'm trying to explain some of the commonly asked questions which you may encounter in an NHS job interview. Now, remember, I'm not trying to give you any model answer. I'm just trying to explain what sort of questions may be asked to you in an interview, what is the concept behind these questions, and what is the panel trying to ask you, and how can you manage them? How can you address them? Remember, every individual, every doctor is different. Their experience, their personality would be different, and they will answer them according to their own experience and their own personality. So one question you may get in the NHS job interview is that how do you manage pressure? How do you deal with stress? How do you deal with difficult emotion that may generate inside you? How do you deal with burnout, or how do you deal with a difficult time when you're going through in work? This question is becoming more common, especially recently, when as doctors, we should be more aware of our own emotions. We should be able to identify difficulties in ourselves, especially when we are going through a difficult time. And we should be able to ask for help, and we should be able to identify signs of burnout and make sure we are taking steps to make sure that we are also looking after our own mental health. So, for example, when this question is asked from you, that how do you identify and manage stress at work, then this can be answered in different ways. Number one, it can be answered with an example. So you can give them an example and show them the steps that you took to make sure that you were able to manage stress and your own emotion at work. Sometimes, yeah, you can answer them with just giving them a generic answer or the steps which may be useful in managing stress or pressure at work. So if you like more information, you can go on internet and read about how to manage pressure and stress at work. But generally speaking, you can divide this into 5 different steps. Number one is actually acknowledging that you're going through a difficult time and you're going through a stressful time. So acknowledging those symptoms inside you, being more emotionally aware, being more understanding of your own emotions. So for example, if you believe that you're working and that is affecting your sleep, you are feeling anxious at work, and you are feeling tired after work, these may be the signs that you may be showing early signs of burnout. This may be the sign that you're going through stress, and this may be the early sign you need to be aware of. So after acknowledging your own feelings and identifying symptoms of stress, the next step would be to actually identify that where is this stress coming from? Where are these emotions coming from? Is there any specific situation at work which is making you more stressful? If there's anything happening at work which you find that is too much for you, so is it the workload? Is it the kind of support you're getting from work which is not, you feel is not useful? Is it that your skills are at the level that you need to have upgraded skills, and you're finding it difficult to actually deal with the amount of task or the complexity of the tasks that are coming your way? So after developing some basic understanding of the source of stress, if you can identify that, then the next step would be to actually acknowledge your limitations. Alongside acknowledging your limitation, you can ask for help and you can talk to others. By talking to others, that means that you can discuss your emotion and social stress with your seniors. You can discuss with your peers. You can discuss with your team members to see if they can actually help you with some of these tasks or some of the sources of the stress. Maybe they can help you to reduce the amount of work that is coming your way, or maybe they can give you some helping hand. So raising that with your senior, talking to them, um, uh, acknowledging your limitation at that point in time, trying to understand how can you improve your skills, for example, that may be useful in managing the stressful situation. Another helpful thing which may help to improve your level of stress at work is to actually learn to prioritize your jobs. So when we are working in hospital, we're working in a clinical setting, for example, as a junior doctor, we may be getting a lot of tasks coming our way. And some of those tasks will be more urgent and important and needed our attention right then and there. And some of those tasks would be the ones which we can actually hold on to, which we can give it to somebody else, or we can ask somebody for else to help us with those. And some of these tasks we'll have to do ourselves. To trying to identify the tasks which are important, urgent, focusing on them first, trying to identify the tasks that you can actually don't need your urgent attention, but that can be done in the near future, sort of trying to put them off for the time being, and then addressing them afterward when you have a bit more time. Again, the concept of time management also come under managing stress, which means that if you're getting too much work to away and you're finding it difficult to finish on time, that might be putting pressure on you. So understanding your limitation in that sense and trying to make sure that you finish on time, you take your own breaks, you go home at time, you get a good night's sleep, you get a good healthy diet. All of these things can actually help to manage your stress. And the final thing you can talk about, which is very, very important, is about taking breaks. So we all work in a very high pressure situation when we are working as a doctor or a healthcare worker. It is important that we take some break, we take some annual leave, we take some holidays, we take some time off work to actually unwind and relax in our own environment. Then in our personal life, in our work life, and personal life should be separated. In our personal life, we should be able to identify some of the things which makes us happy, which may be in hobby, which may be spending more time with our family and friends, which may be going away somewhere else to get away from our routine. Those things can actually also help to manage our stress and our emotions. So in summary, if you asked about how do you identify and manage stress, you can talk about being emotionally aware of your own emotion, ability to understand your own emotion, ability to understand when you're getting stressed and anxious at that time, taking a step back, analyzing situation, that why are you feeling the way you are? Is there anything in the work environment that could be changed, that could be done in a different way to help you? Or asking for help from your seniors. That's very important. Coming up with some plan to improve your workload, to improve your time management, to improve your ability to deal tasks, and then taking some time off from work and focusing on your own physical and mental health well-being by doing activities which help to relax you. So these are some of the tips you can use in an example if you ask that how would you manage stress at work, and how do you deal with your emotion and emotional burnout if this is something you're feeling from working. Or you can answer this by using an example as well. Like, for example, you can use an example that you were working on a ward, and while initially you started to feel very enthusiastic and you worked with your full energy, but you started to realize with time you were feeling very tired and you were finding it difficult to concentrate. Then you analyze what was happening. Then you realize the amount of tasks you were getting, especially by the end of the day, they were just too much for you, and you were not finishing it on time. So you were going home, you're supposed to go home at 5 o'clock, but often you're going home at 6 or 7 p.m. And that was not, you were not having any time to exercise, you were not having any time to relax. You were just going home, eating something and going to sleep, and then coming back to work next day. So again, in those sort of situations, the things I've already mentioned, identifying the emotion in yourself, then identifying where the stress is coming from. In here, if you identified that a lot of the tasks were coming to you at the end of the day and you were trying to finish them by the end of the day, and that you were failing to finish that by 5 o'clock. So maybe you can change the way the tasks were coming to you. Maybe something could be done to make sure that when you first start in the morning, you have a list of tasks to go through. Or if you're given a lot of tasks by the end of the day, then you can see which one are urgent and important. You can do them as soon as they are given to you, as soon as they needed to be done. But if there's something that you can hand over to the on-call, or if there's something that you can put off for the next day, that was not that urgent, that could be done the next day. So that by that you can show them that you have the ability to time manage, you have the ability to list the tasks according to their priorities, and then by doing that, talking to your senior, changing your job plan, changing the ward timetable in some way, that can help to make sure that you finish at time, which means that you can go home and you can do some exercise, or you can do some things which interest you, some of your hobbies, or spending more time with your family, and that can lead to improvement of your energy levels, that can lead to improvement of your mood. So likewise, you can give an example from your own experience of managing stress at work, managing your emotion, identifying the emotions. And I think by doing that, you should be able to manage this question well. So thank you very much for listening to me. I hope this was useful and hope you will be able to answer this correctly in a job interview. I'll see you again in another video of the same series or a different one. Thank you very much.